Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is a webinar where we talk about Lyme disease, and what we talk about is based on what you ask. So feel free to ask questions. The way that you do that, for those of you that are new here, there's a chat box over on the right-hand side of your screen, and you write questions to me through that chat box. As best as I can, I'll try to get through as many questions as I can tonight, but I can never get through all of them. So I'll do my best. During the webinar, I am creating a recording, and tomorrow morning, somewhere around probably 9:30 a.m. Pacific Standard Time, so Seattle time, I will send an email out to you announcing that the edits are done on that webinar recording and that you can go ahead and view it with a link to where you view it at too, okay? In terms of the questions, for those of you that are new here, I appreciate short questions. Long questions get hard for me and those in the webinar to follow. And they also, if I try to post them, they actually jam the computer screen, making it impossible for me to actually post them and sometimes locking my computer screen up. So we don't want to do that. This is the second webinar for the month of June, and then next week we'll do another one. So in the email tomorrow morning, you'll actually have a link not only to see the recording of today's webinar, but also to sign up for the next webinar, okay? So anyhow, I see that there are a number of new names here tonight. It's good to see some new people. And I also see that there's a number of people that have been here before. So I'm glad to see that you're getting benefit and that you keep showing up, okay? So during the webinar, I will be posting questions so that you can see them on your screen if you're participating in the live version. If you are watching a recorded version, you won't see them. And so I will wind up reading those questions as well too, okay? So without any further ado, let's go ahead and get started here. All right, so this is for Jim. Let's see, hi Jim. Let's see, I've had a COVID shot and I was skeptical about the following scenario being possible, but it seems it happened to me. Recently, I spent 2 hours with my son soon after he and his partner got COVID shots. A few hours later, I started getting symptoms much like I had when I got my COVID shot, including headaches, which otherwise I never get. Is it possible for someone like me with a hair trigger immune system to be reacting to a person who just got a COVID shot? Perhaps as a result of that shot causing their body to interact with some COVID germs that may be lingering in them. If this is possible, how can I prevent feeling sick when I'm hanging around a recently vaccinated person? So Jim, I'm not aware of how to answer that. I haven't heard this occur. I'm not aware of any publications about that. I haven't seen any information on the CDC about that. My own sense is I'd be skeptical that you actually were reacting to their vaccine because they just got it and that vaccine would be in them. I'm not clear how that would be transmitted to you. But I don't know, okay? All right, good luck to you, Jim. Hello, Gail. Let's see, hi, Dr. Ross. I had an incident of BPV a month ago. A benign postural vertigo, everyone, meaning you get spinning, feeling like a merry-go-round kind of spinning, vertigo kind of spinning. Let's see. And then the Eply maneuver fixed it. That same night, I suddenly developed night sweats that are triggered by movement. Anytime I move at all in my sleep, I break into a sweat. This then wakes me up and I get getting almost no sleep. I don't wake up sweating. The sweating is caused by moving in bed, and then I wake up. I am emotionally falling apart due to the lack of sleep. None of the supplements or meds you have listed for sleep help. One doctor thought it's my autonomic nervous system going haywire. Another thought my adrenal system. Any theories on cause and ways to stop this? I know I have Lyme and Bart. So I'm really sorry to hear that's happening with you, Gail, and I don't know that I'm going to have a solution for you. But some theories about what could be happening. So the Eply maneuver, everyone, is a way that you can hold the head in different positions to cause changes in the inner ear so you stop having vertigo, okay? That's a very oversimplified thing, okay? But it involves turning the head, okay? Up here in your neck is in your blood vessels is a receptor that if it gets triggered with pressure, triggers activity within your sympathetic and parasympathetic nervous system. And I wonder if somehow that got upset, inflamed maybe as a result of doing the Eply maneuver. And it is now triggering an abnormal responsiveness within your sympathetic and parasympathetic nervous system. Okay, so the sympathetic parasympathetic nervous system is adrenaline and anti-adrenaline, and changes in that can give you sweats. So it sounds like probably turning your head at night may be triggering this receptor here to be activated. Okay, now I don't know why that's happening to you for sure, but I can postulate, because that's the only thing I would think of up in here that you could have moved that might be triggering something like that. It is possible that whatever you had done has inflamed that receptor, and inflammation in those kind of receptors sometimes could take 6 weeks, maybe longer to get under control. My only thought for you would be to try to do some, and you may already be doing it with your treatment, but to be on some anti-inflammatories, whether it's curcumin, 500 milligrams 3 times a day, because this is more maybe non-infectious inflammation. You might even try just regular anti-inflammatories like an Advil or a Motrin, okay? But talk it over with your doctor, see what they think as well too. But that's what I'm postulating might have happened, is some irritation to this receptor in your carotid blood vessel here that now may be just inflamed and is perpetuating this problem, okay? I don't know for sure though, but that's what I'm wondering, okay? All right, good luck to you, Gail. Hello, Lynn. Let's see, hi, Dr. Ross. I'm taking liposomal oregano, clove, cinnamon oil for persisters and CapriPlus for yeast. Because of the number of pills I take and the need to separate these antimicrobials from my probiotics, I think I need to take the antimicrobials at mealtime. CapriPlus says take on an empty stomach, and the liposomal oregano, clove, cinnamon oil doesn't specify. Do you think these supplements will still be effective if I take them with meals? Yeah, I do. And in fact, I work with these supplements and have people take them at meals, and they do fine. So CapriPlus, everyone, is an herbal supplement that has in it caprylic acid, some rosemary oil, and garlic. It can be an effective treatment for intestinal yeast overgrowth. It's made by a company called Karuna, okay? And then the liposomal oregano, or it's actually liposomal cinnamon, clove, and oregano oil essentials, is made by a company called Dr. Inspired Formulations. And it's something that has, based on Johns Hopkins University laboratory research and Petri dish experiments, those oils can be effective against Lyme and Bartonella, as well as the persister growth state of those germs as well too. And that's why Lynn's probably using them. Okay. All right. Thanks, Lynn. Good luck to you. Hello, Dave. Hi, Dr. Ross. Besides using it for COVID, some people are using ivermectin to modulate the immune system in Lyme disease. What are your thoughts on using it as an immune modulating effect on Lyme? Thank you. So ivermectin, I don't know why, but all of a sudden ivermectin, people are thinking they can use it for everything. And I'm saying it that way. There's no science I've seen that shows that it can modulate the immune system. I also know that it's become a popular thing to try for the idea that some people, there's a theory out there that some people may not be recovering from Lyme because they have parasites in their bloodstream, and that if you use ivermectin, that will take care of that too. What I would say about the parasite theory is there's no science supporting that there are chronic parasites involved in people with Lyme either. And so I don't usually support that theory. I will use it if I've got intestinal parasites, and the intestinal parasites have been shown to respond to the ivermectin. But in terms of using it as an immune modulator, I don't see the science on it. And I would say I'm skeptical. Suddenly, ivermectin has become the it drug of the season. Everyone thinks it can do everything. And the reality is it probably has antiviral properties, at least in how it works. And the reality is in how it works, it's antiparasitic. It is probably not antibacterial. And I see no evidence that it can be that it can modulate the immune system as well too. Okay, those are my thoughts on it. All right, good luck to you, Dave. So I did make a comment here. So the reason I called it the IT treatment, Lyme disease, for those of you that have been around long enough know this, but those of you that are new, we go through fad treatments where suddenly everyone flocks to a certain treatment thinking it's going to be the thing that's going to save the day on their illness. And this season, it seems to be ivermectin. And I suspect we'll find out over time it's not that useful. Anyhow, I just throw that out for you. Okay. Hello, Dave. Again, let's see how Dr. Ross. Should I stop taking supplements like vitamin C, vitamin D, and zinc prior to receiving the COVID vaccine? Also, should Lyme patients with IgG deficiencies still take the vaccine? Some doctors say it will not provide adequate protection since the immune system won't be able to provide the necessary reaction. Thank you. So regarding your immune response in COVID, so the vaccine is triggering two types of responses. Number one, it's training your immune system to make and manufacture antibodies. And those would be two families of antibodies, IgM and IgG antibodies, okay? So antibodies are proteins made by the immune system that will attach to a germ. And once they're attached to the germ, other immune cells will come in and basically kill that germ, okay? So they kind of think of antibodies as acting as an antenna that sticks on a germ and acts as a signaling device, okay? That's one way that the immune system gets rid of infections. The other way that the immune system gets rid of infections is to actually just develop T white blood cells that actually will attack the germ directly without even having the antibodies involved, okay? And so the vaccine is also teaching your immune system to do that too. So I would get the vaccine, even if you tend to have immunodeficiencies of immunoglobulins like the IgG antibodies, but because you're also training your immune system to make the white blood cells that will attack the germ that don't necessarily need antibodies to work, okay? All right. And then in terms of the supplements you listed, the vitamin C, vitamin D, and zinc, those are things are you okay to take prior to getting the COVID vaccine done. All right. All right. Thanks for your question, Dave. Hello, Tim. I'm Dr. Marty Ross. I hope you're doing well. I am. Thank you. Let's see. I was just wondering how long to use cholestyramine for. I tested positive for mold through real-time labs and have been treating with cholestyramine for 2 months. Thank you for all you do. So you're welcome, by the way. So treating mold toxin illness is kind of tricky. On most people, somewhere within about 6 months, that's how long you need to use binders to get those mold toxins that are trapped in you out. So cholestyramine is a binder, okay? Usually what I will do in my treatments is I do one of two things. If I put somebody on binders like a cholestyramine or the supplement forms of binders like GI detox, I will have a person on for about 3 months. If the person has gotten completely well from removing their molds, I don't do anything else. We're done, okay? But if I've got somebody that still is having a lot of symptoms after 3 months of doing binders, then I want to see, are we making any headway? In which case I will wind up repeating either the real-time lab test, urine mycotoxin test, or repeating the Great Plains test, if that's what we've done, and to see, are we making any headway, all right? Now, if you're about 4 to 6 months into a mold toxin treatment with binders, and you're not getting any better, and your labs don't show any improvements, then it's time to start thinking about whether you might actually have become colonized with mold, and the mold that you're colonized with in your sinus passages or in your intestines start producing their own mold toxins. So you become your toxin brew pub, basically. And so if I've got a person a good binding regimen to get their mold toxins out, and they're not getting any better, and we're about 4 to 6 months in, and we see worsening picture of their mold toxins, then I got to start thinking about, are they their own brew pub? And in which case I'll start putting them on things to actually start killing mold that might be colonized in the sinuses or in the intestinal passages. Okay. All right. So let me just do a general explanation for those of you that are new to the idea of mold toxin illness. So there's a physician named Richie Shoemaker that is the person that first described mold toxin illness. And what he was able to show is that there's 25% of us that have a genetic setup where when we walk into a building that has mold behind the walls and we breathe in the mold toxins from those mold behind the walls, that we breathe those mold toxins in, they get into our bloodstream, and that in 25% of us, they become trapped in our bloodstream. Okay, we can't get rid of them. What happens in 75% of us is our immune cells will see those mold toxins in our bloodstream, and some white blood cells will tag those mold toxins, and then other white blood cells will come in and break down those mold toxins, and then we don't have any problem. But if you're one of the 25%, what happens is they don't get tagged, they don't get broken down, and then those mold toxins get moved to the liver, which is supposed to clean out fat-soluble toxins like mold, but the liver doesn't do a good job either. And so the liver isn't able to transform them. They get moved out of the liver into the gallbladder and then out into the intestines. And out in the intestines, because they're still a fat-soluble toxin, they get reabsorbed right back into the bloodstream, okay? And what happens with mold toxins in your bloodstream is they trigger an inflammation reaction within your white blood cells. So your white blood cells will manufacture a bunch of chemicals called cytokines, all right? When you have Lyme in you, your white blood cells overproduce cytokines, and they give the same symptoms. So excess cytokines make you hurt, make it so you can't think, give you fatigue, disturb your sleep, interfere with how your hormone systems are working, okay? So too much mold can look like Lyme, basically, all right? Now, the way we treat this is we, first of all, do a urine test to see, are you peeing out too many mold toxins? And if you are, we want to start trying to get them out of you by binding the ones that have worked their way into the intestines, all right? Using something that binds fat-soluble substances like cholestyramine, which is a prescription medicine we use to treat high cholesterol, or you can use binder products like Biobotanical Research has a product called GI Detox that has in it humic acid, fulvic acid, zeolite clay, some charcoal, and some silica in it. Those are all things that can bind up toxins too, okay? All right. And then again, so not everyone that has mold toxicity is necessarily been colonized by mold, but some of us, if we're in moldy environments, some of those mold spores from the world around us get into our sinus passages, or we swallow them and they get into our intestines, and then we can start manufacturing our own mold toxins, okay? The trouble is there's not a decent test that says you're colonized with mold and that you actually have mold colonizing your intestines. There isn't decent testing. So we determine you might be colonized kind of as a fallback position if you're not getting better when we've been using binders that should get those toxins out, okay? Now, one other reason you could not be getting better and your mold toxin levels could keep going up instead of being colonized is if you're still living in a building with mold, okay? So as part of a workup when you have mold toxicity illness, I usually will recommend that my patients also have a home inspection done to make sure that their home is not a source of giving them toxins, okay? And it's not always apparent you have mold in your home. Sometimes you have to have an inspector that can help identify where those areas are, all right? All right. Good luck to you, Tim. Everyone, let me just do a quick screen share so you can look at an article to even give you more of an explanation of this. Okay, so this is my Lyme disease information site. It's called Treat Lyme by Marty Ross MD. To find the majority of the articles that I've written over time about Lyme disease and the conditions related to Lyme, take a look at this online Lyme guide right here, okay? And then the detoxification chapter, you can find this article called Mold Toxin Illness. And in here, I just talk about Dr. Richie Shoemaker. I talk about how do you test for mold toxin illness. And I also talk about how you work with binders to get those mold toxins out, okay? And I don't think, yeah, and I even mentioned that down here, if you're not getting better at a point, add in the antifungal treatments, okay? All right. All right. Thanks for the question, Tim. And good luck to you. Hello, Amanda. Hi, Dr. Ross. I've been fighting Lyme POTS with mixed connective tissue disease. I have had ups and downs with the disease. I'm having a really bad flare, partially because we were exposed to pretty toxic mold. And since then, I have a vasculitis that seems to not want to go away, and my hands are red and painful. So my question is, how do we resolve this type of vasculitis? So first of all, I hope you're talking with your physician about this, okay? Because I don't have your whole story. I can only give you some ideas based on what you described here. All right. Sometimes so these illnesses like Lyme and like POTS trigger an autoimmune illness like lupus, like arthritis, that can give you the damage to your tissues. And sometimes you have to be put on immune modulators, of which, for instance, prednisone is one, although I usually will not go to prednisone, but sometimes you need to be put on immune modulators to keep that inflammation in the mixed connective tissue illnesses under control, okay? If you, so anyhow, I would just say that, okay? Now, ultimately, though, what is likely triggering all of this inflammation, even autoimmune illness if it's there, is the infections. So you need to treat your infections with herbal or prescription antibiotics, and you need to actually treat mold toxicity, if you have that, for instance, with binders to help pull that stuff out. So you need to deal with the underlying problem, but you may need to get a rheumatologist involved to help you deal with the inflammatory aspects until you can get better control of the mold toxins with binders and also the germs by using appropriate antimicrobials, okay? All right, so just some thoughts for you to think about, okay? All right, good luck to you, Amanda. Let's see. A new recent symptom last week is strange sensations on the sole of one foot. Is this necessarily Bartonella? Not necessarily. I mean, it's possible to have something else giving you strange sensations on your foot. To consider if you have Bartonella, I like to look at the whole range of symptoms before determining if somebody has Bartonella. And obviously, if you have positive testing showing Bartonella, I would treat you for that too. At least that's how I work in my practice. But symptoms that can suggest Bartonella are pain on the soles of the feet, usually both feet, usually worse in the morning, and it can improve as you walk and move throughout the day, okay? Number two, another thing that can sometimes lead another group of symptoms you can have is sometimes Bartonella can trigger a lot of neurologic as well as psychiatric symptoms. So psychiatrically, people may have a lot of ongoing anxiety. They may have some depression, okay? They may have hallucinations, for instance. Neurologically, you can have a lot of numbness. You might even get nerve injury pain, like burning and sharp stabbing kind of pains that can be at various places in your body. Bartonella often can give severe cognitive dysfunction, really bad thinking problems, for instance. Let's see here. Bartonella sometimes can give muscle twitches, sometimes can give tremors, and sometimes Bartonella can also give feelings of air hunger, okay? So just by itself, that does not say Bartonella to me, okay? All right, good luck to you. Yes. Hello, Anna. Let's see. Hello, Dr. Ross. Would you please comment on IVIG, intravenous immune globulin therapy for Lyme patients? Have you seen benefits in your practice? Thank you kindly. So intravenous or IVIG, everyone is giving immunoglobulins, which are antibodies and things that fight infections. Okay. And these immunoglobulins are gathered from a bunch of donors. And so basically when you do IVIG, there is one concern I have about it, and that even though these blood donors that give their immunoglobulins to you are screened for other infections, there is the possibility that they would still have some kind of infections that, like chronic virus infections, et cetera, that get transmitted to you with this, okay? All right, so I just want to say that it's a caution. It's not, you have to be careful with this, okay? So the one condition for which IVIG is approved is people that have a neuropathy, a type called small fiber neuropathy, where the very, very small nerves out in your skin and in your tissues are inflamed and injured, and you've got neuropathy from that. And IVIG has been shown to be beneficial in that situation. And usually will get approved by insurance if you've got the skin biopsy showing that you have the small fiber disease, okay? Now, there are some people that have perpetually low immunoglobulin levels too, that get recurrent viral infections and have a hard time with Lyme. If you have extremely, extremely low IgG antibodies, sometimes there can be benefit from doing the IVIG as well. The difficulty is getting insurance to pay for it, and it's very expensive stuff, okay? So I have had benefit in using, when people have low antibodies, doing IVIG. There are times that people will get benefits from doing that, all right? In terms of people that don't have low antibodies and people that don't have small fiber neuropathy, I have not seen great benefit from doing IVIG, all right, to answer your question, okay? All right. Thanks for that question, Anna. Good luck to you. Hello, Frank. Let's see. Hi, Dr. Ross. I was on IV Rocephin for 2.5 years before my doctor removed the IV. Was this too long? Also, how long should I remain on amoxicillins, azithromycin, and minocycline? It's been 2 years. Frank, I don't know enough about your situation from terms of what your germs are, what effect you've had with the antibiotics, et cetera, to really comment about whether what was done was too long or not. Okay, I don't know for sure. What I would say is, yeah, this looks like you've been on things a long time. And what I can reflect is what I do in my practice, which is usually after on any antibiotics I put somebody on, usually about every 6 months or so. In my practice, I have found benefit in changing to a different antibiotic regimen. Okay, so by how I work, yeah, this seems a little bit long, but I don't know enough about your history to know exactly enough about you to tell you exactly for you, was it too long? Okay, all right. Good luck, Frank. Hello, Mary. Let's see. Mary says, do you use a VIP nasal spray? So everyone, VIP stands for vasoactive intestinal peptide. So it's a protein that's actually comes from it or is made within the intestinal tract, but it does get into the bloodstream. It may have some ability to help regulate inflammation. The person that has advocated using the VIP nose spray is Dr. Richie Shoemaker, who I mentioned earlier tonight, and as part of his protocol for people that stay very sick after removing mold, he believes that a lot of that is just because you've got inflammation that keeps perpetuating itself, and VIP in some of those situations might be helpful. Have I found it beneficial in my practice? Not really, but that's where it comes to us from, okay? All right. Thanks for that question. Hello, Anthony. You see, I got clawed by a cat on my finger around 10 years ago. It swelled up and a red line developed up my arm to under my lymph node, armpit, which also swelled. Antibiotics cleared at the time. It will return on the same finger. It will multiply in size very rapidly until antibiotics again reduce the swelling. It has reoccurred around 10 times since. Does this sound like Bartonella, and what would you recommend? Would a month's course of doxy be any good now, or should I go an herbal route? So I don't know that it's Bartonella because, again, usually Bartonella is going to give a whole host of other symptoms that I discussed earlier, okay? But could Bartonella give you recurrent swelling in your lymph system and inflammation within the lymph system, which is what that red line is? It's called lymphadenitis. Yeah, it could. I would probably, before necessarily saying it's Bartonella, especially if you don't have any other symptoms of Bartonella, I would consider getting high quality Bartonella testing. And what I would suggest doing for Bartonella testing, talk to your doctor about this, obviously. Again, I don't know enough about you to give you medical advice you should follow. You should follow the recommendations of your doctors. But they could look at doing a test through IGeneX. IGeneX has a Western blot Bartonella test. And what they're doing with their testing is they're looking to see if you're making antibodies against the whole family of Bartonella that includes 15 different kinds of Bartonella germs that can give you problems, okay? All right. If you were to go through a standard lab test, they would be looking to see if you have Bartonella of one variety, which is Bartonella henselae, but we think that there can be 15 strains. Now, I got to admit, I mean, the kind that usually is transmitted by cats is Bartonella henselae. All right, so maybe that's what you got. But I would look at the IGeneX Bartonella IgM and IgG Western blot, or in their order form, they call that the WB test. Okay, and that test, according to their validation standards or validation testing, has the ability to identify if you have Bartonella about 90% of the time. So it's a pretty good test. All right. In terms of how long do you treat Bartonella? You know, in an acute situation, I might treat for about 2 weeks. But if you're having chronic recurrent problems, I would want to know more what's going on with the rest of your symptoms to help me determine how long to treat, okay? All right. The other thing is, if it is Bartonella and it keeps coming back with antibiotics, I would, if you were my patient, what I would wind up doing to that person is I would wind up, in addition to using Bartonella antibiotics that target growing forms, I would want to be on some liposomal cinnamon, clove, oregano capsules to help treat what is known as persister forms. All right. So Lyme and Bartonella have the ability to have growing forms of their germs, and then some of their germs will go into hibernation. And in the hibernation state, they slow their metabolism way down, and they ignore all the antibiotics that we throw at them. So it's going to keep coming back. It's going to get reactivated because you can't get rid of those persisters. So in a situation like this, if I determined it was Bartonella, when I use antibiotics the next time around, I would want to also use something to treat the persister forms too. Okay? All right. Thanks for the question, Anthony. Thanks, Rhonda. Rhonda says, hello. Thanks so much for having us. You're welcome. I appreciate that. Hello, Teresa. Teresa asks, what is C6 peptide? So C6 peptide is peptides are proteins, okay? So this is a certain protein that is found as part of Lyme infection. And we can look and see if you have antibodies against that. So there is a C6 peptide antibody test, or a C6 peptide ELISA test, basically. is not a perfect test. And so if it comes back positive, great. It may mean you have Lyme, but it could be a false positive. So we always have to go ahead and confirm whether it truly is Lyme by doing either an immunoblot or Western blot testing. Okay. Hello, June. Let's see. How long should you stay on herbs for Bartonella after getting up to full dose and with taking liposomal oregano, cinnamon, clove oil? So everyone, the two antibiotic herbs that I like using to treat growing Bartonella would be sida, acuta, and houttuynia. And then in terms of treating persister growth state or non-growing state, I should say, of Bartonella, I would do the liposomal, cinnamon, clove, and oregano oil. Okay. All right. Also, those oils may treat the growing forms as well, too. So an average treatment length of a Bartonella is going to be about 4 to 6 months. That's on average. That's what I see in my practice. But sometimes you got to treat longer. So how long would I treat? I would treat as long as you're seeing benefit and it's working. But you need, especially on your herbal options, you're going to need to give at least a couple months before you determine it's working. And how you know it's working or can determine it's working is, are the Bartonella symptoms getting better? Okay, so if one of your big symptoms of Bartonella was raging anxiety and you're on these herbs and suddenly your raging anxiety starts getting to be not so raging or lower levels, that probably means it's working. All right, thanks for your question, Jim. Hello, Amanda. Let's see. Sorry, did not finish my question. My vasculitis is bad, and the mold toxins seem to have really fired up. My hands are so painful and red. What do you recommend, and is this the mold plus the bugs? Are my arteries not allowing for proper blood circulation because of all this stuff going on? It just feels very unmanageable, disappointing. Nothing seems to be helping me. So again, Amanda, I think I did answer that before. I would wind up talking to your Lyme doc and see if you might get a rheumatologist involved to help with this, okay? But I also, in these situations, would keep working on removing mold toxins, and I would keep working on getting the germs under control. Sometimes with poor circulation problems that can happen in these illnesses, sometimes you need to be on medicines that dilate your blood vessels, like Norvasc as a calcium channel blocker that can sometimes help. Sometimes being on something called nifedipine, or sometimes just being on potent anti-inflammatories that rheumatologists would use. Okay, so talk to your doctor about this. All right. Okay. Thanks for that question. Hello, June. Let's see. Why does IGeneX show highly positive for Bartonella and Babesia, but Kaiser Labs show no infection? All right. So IGeneX does different quality tests than Kaiser. All right. So Kaiser is probably going to be doing standard FDA, Food and Drug Administration approved test kit. And they're going to look to see if you make antibodies for Bartonella against one or two strains. One is called Bartonella henselae, another one called Bartonella quintana. Okay. By comparison, IGeneX can also do an antibody test called an IFA against Bartonella henselae, but they also do a Bartonella Western blot that's looking to see if you make antibodies against the family that includes all 15 strains that can infect a person. So it's a bigger fingerprint, if you will. All right. In terms of Babesia, IGeneX has developed a very good way of testing and a more predictable antibody test than Kaiser does, and it just tends to work better. Plus, For Babesia, there is a microscopic exam called a fish test that Kaiser doesn't offer. Okay, so basically, the Kaiser testing is poor quality, and IGeneX is a much better quality. All right, and IGeneX is looking to see if you have more strains for both Bartonella and Babesia than what Kaiser is looking for. Okay, all right. Good luck to you, June. Hello, Gloria. Let's see. I understand N-acetylcysteine, NAC, is being removed from the marketplace. I found it helpful for Lyme in the past. Do you know why? And is there a substitute for it? So I don't know the specifics about it, but everyone, N-acetylcysteine is one of the building blocks for chemicals that is turned in our cells into glutathione. Okay, so a very powerful antioxidant, glutathione. My understanding, and I haven't investigated this thoroughly, but what I've seen, just pieces of information I've seen, is that I believe that there is a drug company coming online that has some type of an NAC, and therefore now it's a drug, and therefore it can't be classified as a supplement anymore. Okay, I think there's something to do with that. I'm not 100% sure though. Okay, but your workaround it are two things. So one, you could try to do something called alpha lipoic acid, which is a very strong antioxidant that helps your cells produce more glutathione on their own. Okay, because again, the reason you're using NAC is ultimately it's turned into glutathione. All right. So alpha lipoic acid is an antioxidant that creates a favorable environment in your cells that can help your cells produce more glutathione on their own. And usually you're going to dose that somewhere between 200 to 400, 200 milligrams 3 times a day on the alpha lipoic acid. All right. Or the other thing you can do is just take glutathione. So take the end product that you want to have that N-acetylcysteine is turned into. And if you're going to do that, what I like using is a liposomal variety of glutathione. Liposomal means it's glutathione that's microscopically wrapped in fat. And when you microscopically wrap your glutathione in fat, that increases absorption of the glutathione. And in fact, one of the companies, Research Nutritionals, that has a product called Tri-Fortify, has been able to show through the scientific testing that they get marked increases in glutathione inside red blood cells by using their liposomal formulation. Okay, so there's some evidence that can work. If you're going to do that, the Tri-Fortify by Research Nutritionals, there's a watermelon and orange flavor. A typical dose would be about a teaspoon 1 time a day. Okay, all right. Good luck to you, Gloria. Hi, Dr. Ross. I have 3 quick questions. Can acute Lyme disease cause chest congestion? For acute Lyme disease, fever as high as 102 degrees, are herbal antimicrobials as good as doxycycline? And lastly, how to treat persistent forms of Lyme and acute disease if on doxycycline? Thank you so much, Clay. So for acute Lyme, the only studies that we have that have been done that show something to work is the doxycycline studies, okay, prescription antibiotics. There are no studies that prove long-term benefit from using herbal antibiotics in an acute setting. And so for that reason, even though I work with herbal antibiotics in a longer-term chronic situation, I do not recommend herbal antibiotics for acute Lyme. I don't know that they work. I don't know that they prevent you from getting a chronic Lyme disease down the road. Doxycycline, we do have evidence mainly from mouse studies that it can be quite effective actually, but we don't have any such data for the herbal antibiotics. And the reason to use doxycycline too is it's going to cover a variety of infections that can happen when you get bit by a tick. Covers the Lyme infection, can cover Bartonella, can cover Babesia, can cover Ehrlichia anaplasma, maybe mycoplasma if those get all transmitted. And so it's kind of a good gunshot antibiotic that covers the whole range of things in an acute situation, okay? Can acute Lyme give you a temperature to 102 degrees? Yeah, it can. I've seen that happen before. And then can it give chest congestion? I don't see that listed as a symptom of acute Lyme. So I'm not aware that it does, nor have I seen that in my patients, okay? All right. Doesn't mean it can happen. I just haven't seen it that way. All right. Thanks, Clay. All right, everyone. Let's see here. Hi. Let's see. This next one is from Missy. Hello, Missy. Let's see. I have Lyme, Bartonella, ehrlichiosis, mycoplasma pneumonia. Have tried a few antibiotic pulsings, still not well. This week, band 93 and some gallbladder issues. And there's more parts of the question here, everyone. Just bear with me a minute. Let's see. Recommend having gallbladder removed and Rocephin IV with 2 other antibiotics. Ceftin, azithromycin, diflucan, and probiotic. Thoughts on having gallbladder removed? All right. So I don't know. It's hard for me to say. I don't know anything about what's happening with your health other than you have certain germs. So I don't know whether the gallbladder is giving you problems. All right. So what I would tell you is that we do know that Lyme can infect the gallbladder, and that when we use IV ceftriaxone, also known as Rocephin, that sometimes causes your gall, can lead to you developing gallstones, okay? That's not every kind of IV antibiotics, but the IV antibiotic ceftriaxone can lead to that happening. So if you are having gallbladder symptoms like a pain near your ribs, or somebody has already said you have gallbladder disease, gallbladder inflammation, and it's full of gallstones, if you're going to use the IV ceftriaxone, I probably would think twice about that, or use an antibiotic that doesn't give gallstones, like ceftazidime would be a possibility. Something called Ivance would be a possibility. But if Rocephin is the only thing you have access to, then you might want to, if you're full of gallstones already in your gallbladder, then possibly removing it is an option. But again, I have no idea because I don't know enough about your history here. So this is something you should talk to your existing provider about. Okay? All right. Good luck to you. Hello, Pat. Let's see. Hi, Dr. Ross. How are you? I'm well, thanks. A little tired tonight, but I'm well. Yeah. Let's see. I got bit by a small, I didn't like that. You even put the word down. Tick recently. After several days, I got severe symptoms. I took the doxycycline for 2 weeks. After 1 day, my symptoms greatly improved. However, as you know, antibiotics alone don't get rid of the pathogens. I went to an ND. She put me on homeopathics and some supplements. Do you think silver would be a good antimicrobial? And what more should I do for building my immune system? Would a VC and mushroom combo be good? Thank you for the great red site. Thank you for educating people. So as I said, for an acute tick bite, there's no evidence that herbs work. I'm sorry that we just don't. They may, but we don't know. I usually, for an acute tick bite, especially if it's a black-legged tick, black legs, red body, that usually is a deer tick, everyone. If it is a deer tick that bites you, and you, especially if you're in an area where there is a lot of Lyme disease, meaning the ticks might carry it, and especially if that tick has been attached for a while, So ticks that have, I think it's like after 96 hours, there's almost 100% chance they could have transmitted if they have Lyme. At 24 hours, the transmission rate is almost 0%, but not zero. Brief tick attachment is almost a 0% chance it could transmit, but not zero, so it still could. I usually like to use doxycycline because that's the one that has science behind it that says it stops all these things. And I usually like to use it for 3 to 4 weeks. That's what my own way of handling it is. Okay. All right. I can show you an article where I talk about this a little bit, so you can look at that for more detail. Let me do that here for a minute. I'm going to do a quick screen share here. All right, everyone. So take a look at this tab up here called Acute Tick Bite. And this is where I describe what to do and why to use doxycycline and how long should you use doxycycline, okay? So anyhow, take a look down here. All right, Pat, good luck to you. Hello, Missy. Have gallstones and nausea often been recommended? I remove my gallbladder. What would be beneficial for Lyme treatment? Let's see. All right, so I think you just answered my question. You have a lot of gallstones and you have nausea. So the reason to actually remove your gallbladder isn't because of Lyme or because you're going to be on antibiotics. It's because you're having a lot of symptoms of your gallbladder disease. And so in that situation, yeah, it makes sense to get your gallbladder out, I think, okay, from what you've just written here. Would treating Lyme be beneficial? I don't know, because I need to know a lot more about what your symptoms are again, okay? All right, good luck to you. Well, actually, if you're asking, will treating Lyme help your gallbladder? It's hard to say, okay? Good luck. I may have seen this question already. Yep. So it's a question that's been asked twice. Let me get rid of that. Amanda Sanchez says, thank you. You're welcome, Amanda. Hello, Eileen. Let's see. My husband tested positive for 8 strains of Lyme about 6 years ago. Plus, he has symptoms of BART. Taking the houttuynia cordata and sida acuta make him lose his hearing. He has also taken the liposomal clove, oregano, and cinnamon oil. He wants to stop the herbs and just take the oregano combo. We have ordered the ATP 360. What do you advise? So I don't advise anything, but I would make comments. The reason I don't advise anything is I can't tell you directly what to do because that's would be treating you, and I don't have a relationship with you actually in that regard. Okay, but these are just some thoughts. So in my so the oregano, the cinnamon, clove, oregano. Oils can, according to Johns Hopkins research, treat growing and persister Bartonella and can treat growing and persister Lyme. So could it treat the infections? Yeah, okay. In my experience, do I see that as enough to actually deal with these infections? Probably not, all right. The other thing that sometimes can be quite helpful for the Lyme side but is not going to be sufficient to treat the Bartonella side would be a product called biocidin. Biocidin has a variety of herbs in it that can kill the Lyme germ, as well as break up biofilms. And that product can sometimes be helpful. But I am doubtful that this is going to be a strong enough combination to get rid of Bartonella just by itself. Okay. All right. You should be talking to a physician about this to see what specific ideas they give you. Because if you can't tolerate this, then you might need to be considering being on antibiotics because there aren't many other options you have herbally for Bartonella. Okay? All right. Good luck, Eileen. Hello, June. Let's see. If I'm taking liposomal biocidin, do I need anything else for yeast? So again, everyone, biocidin is this herbal compound made by biobotanical research that has a number of germ killers in it and also herbs in it that can target biofilms and help break down biofilms and help prevent them from forming as well too. Okay. There's 3 varieties of that medicine there, or that herbal nutritional, I should say. And that is, there's a product called biocidin LSF, which is the liposomal variety. So it's biocidin microscopically wrapped in fat to increase its absorption. Okay, so it's the form that has the greatest chance of getting into your bloodstream. All right. And then there's also biocidin capsules, and there's biocidin liquid. Now, those herbs are not as readily absorbed into the bloodstream, leaving much more available to treat yeast and kill yeast in your intestines. Okay. So I would suspect if you are just doing the liposomal, I would recommend probably doing more than it to treat intestinal yeast or prevent intestinal yeast, because I think that so much of that is going to be absorbed into your bloodstream that it's not going to be there to actually do much for your intestinal yeast. Okay. So herbally, for instance, you might want to look at something called CapriPlus, made by Karuna. That's a product that can treat yeast in your intestines. It's got garlic, rosemary, and caprylic acid in it too. Okay. All right. So everyone, let me do a quick screen share here. Thanks for the question, June. All right, so this is my Lyme information site. And if you just type in biocidin here, there's an article I've written about what is in biocidin, how it works, and how you use the various forms of it. Okay, all right. So you take a look at that. All right, and then the other one I would, let's see here. Oh, in terms of what to do for yeast, take a look at my section here on yeast, and there's a guide that I have about various ways to approach yeast as well too. Okay. All right. Thanks for that question. All right. Listen, everyone, I'm sorry to have to do this, but I am just pooped. I'm fading. I had a very complex day with my patients, and I did not get to take the break I usually have before we start the webinars. I'm also hungry, and I think I need to take care of myself here. So I'm going to go ahead and call this quits for tonight. So I've enjoyed sharing the last hour with you. If I wasn't so tired and hungry, I'd probably keep going, but I'm tired and hungry. So I'm going to go take care of myself, okay? I also got 2 Basinjis here, my dogs that need some attention as well, too. So what we'll do is next week, there'll be another webinar. Go ahead and sign up for that tomorrow morning when I send you the email with tonight's recording. I apologize for stopping a little bit early, but anyhow, I need to go ahead and do that. And it's been good to be here with everyone tonight, and I hope you found some benefit. Look forward to seeing you next week, okay? Good night, everyone.